Awesome. And we are off on the road again. Welcome back to My Before Coffee. The podcast is not a podcast where I ramble on about the most, I wouldn't say random things because I do try and stick to topics. So it is just rambles though. Lots of rambles. It's unedited, real, raw. You get what you get. You get my indicator. You get my toddler in the back. You get all of that extra. It's like bonus points. It's bonus points. All right. So today we're off. It's a Tuesday morning. It's bright and early. Well, it's not that bright and early. It's 7 a.m. Quarter past 7. 10 past 7. And we are on the way. We're going to be dropping off little one at nursery. I'm going to be heading into the studio. I've got one client and I am going to be filming some fresh new classes for this week. Not for this week, for next week. This week's classes are already up and out. You'll be able to see them over on my YouTube. We've got a body bar class that is currently live. It has premiered. It's live now. And later on this week, we also are going to be having a restorative aerial yoga class. They're express classes. I do not do anything longer than 30 minutes because let's be honest, if you're doing an online class off of YouTube, you don't have more than 30 minutes. So we do 15, 20 minutes and 30 minutes express classes over there on YouTube for you to check out and enjoy. If you're a member of Koi, you get access to them early on. And there are a few extra classes that drop as well. Welcome, everybody. Please let me introduce you to my gorgeous son who has joined in on this podcast this morning. Right, so for today, I wanted to do more of like a story time. I was thinking a little bit about this morning about what I would like to talk about today, or kind of like I like to have at least one topic. And I couldn't really think of anything specific, but I thought, you know what, let's jump on in. Let's do a little story time. And mainly because I think there's a lot of other women who have gone through a similar thing, who have felt the same sort of thing. And I wanted to kind of share how I have navigated through that in case there are, women out there who are struggling with the same sort of situation and are trying to figure out how are they going to handle this? How are they going to better their health through this little bit of an obstacle? Because it is an obstacle. It is. It is quite challenging, if I may say so myself. So, story time. About, I would say it was 4 years ago. I should have thought about this before I jumped on, right? So it was about 4 years ago. I started feeling considerably unwell. At that point, I was already struggling quite significantly with cystic acne, irregular periods, the usual sluggishness, tiredness, fatigue, brain fog, a lot of those things. And that was I would say 4 to 5 years ago. I had started healing somewhat, but not considerably seriously. It was only really until later on, until I had this bit of a health scare. So we'll rewind a little bit extra to about 5-ish years where I'm dealing with, the cystic acne, the terrible period symptoms, and horrible fatigue, horrible fatigue, guys, horrendous. I never understood why I was this exhausted. And so there was a lot that I was dealing with. I was also at that point lactose intolerant, which is a very interesting story, which I might just weave into this as well. So I was, operative word being was, I was lactose intolerant. And a lot of my health issues, I believe, was onset through trauma. Okay. That's why I'm a big advocate for reducing stress and for processing trauma. If you've gone through a hard time in your life, just go do the therapy, because your body is going to find a way to deal with it. whether it has your permission or not. And sometimes that can manifest into you not being well. So struggling, I was lactose intolerant. I struggled with a lot of symptoms. I had then, the symptoms had progressed into things like heart palpitations, trying to think what else there was. There was a few other things. So I had then obviously progressed in with some other symptoms. I was also struggling with considerably low blood pressure, scarily low blood pressure. And it would come and go. So it wasn't like I had a constant low blood pressure. I would be normal and then it would drop. I naturally had slightly below the normal, slightly below 120/80, which was normal for me. I was pretty fit, pretty active. So that felt normal to me. And so that obviously continued to progress into this big health scare that I had, where I was not feeling well at all the one day. And at this point, I'd already been trying to suss out what was wrong with me because I was piecing all these little symptoms together. At that point, I was also studying holistic nutrition, and I was getting a better and better idea of what was going on. And it was this big health scare. I was considerably sick the one day. I was not feeling well. My blood pressure had dropped and it just was not coming back up. And I was getting really nervous. My heart was having several palpitations. So I had then decided that I need to go see a doctor. So I was like, okay, I think the best bet here is let's quickly head through to a walk-in doctor. And so they would be able to assist me pretty quickly. I wouldn't need an appointment essentially. And that turned into, I had my sister come pick me up because I was considerably nervous at that point to drive, which is saying something because I would do anything. And I had my sister take me to the hospital, or not the hospital, the doctor, which was just down the road. It was just a normal GP. And as we were driving, I was feeling even more, I was coming out in a cold sweat. I was feeling very nauseous. And at that point, my blood pressure had dropped to, I think it was a 74 over 52, something to that, something on those lines. Okay. And which was obviously at that point considerably concerning. And I had taken my blood pressure, it must have been about 8 times. So I had the the blood pressure monitor with me, and I was taking it at like 10-15 minute intervals. So I'd been taking it often, and then I stopped taking it just before we left for the doctor. So I was like, we're going to go to the doctor, they can do my blood pressure, they'll see how low it is. So as we pulled into the parking lot, I threw up. I don't know where that came from. I just, threw up, felt very lightheaded, walked into the practice, well, more like stumbled, let's be honest. Stumbled into the practice, and then I was like, I need to see the doctor. She was like, okay, not a problem, take a seat. We'll get you in just now. So I'm like, okay, cool. At that point, I started feeling a bit better. Like the color was coming back to my face. My sister was like, you're starting to look a bit better. It's like, nonetheless, let's just see what the doctor has to say. I get into the doctor's office and I explained to her what my symptoms have been and what I just experienced. She took my blood pressure. She was like, but your blood pressure is normal. I'm like, I understand that, but I've taken my blood pressure multiple times this morning and it's been X, Y, and Z. And I gave her the stats, right? I gave her each reading. She was like, oh, okay. And she said, I would like to send you for some blood tests. So I was like, perfect. I've been wanting to see my naturopath. I've been wanting to get some blood work done because I do suspect that there is a bigger issue at large. I just really needed to get this low blood pressure. I needed, some help to get that back to normal. And she, honest to God, guys, she looked at me. She was like, oh, to like test your vitamin A levels. And I'm like, no, ma'am, like I would like to have a full panel done on my thyroid for starters. And I would also like to do a hormone panel and possibly look at my cortisol levels. She goes, oh, okay, well, I'm just going to send you for the thyroid and an iron panel. I was like, okay, well, thank you. So initially, she wasn't planning on sending me for the thyroid. She was only going to send me for an iron panel, but because I had spoken of thyroid, she said she will send me for the thyroid panel as well. So first off, already I'm a little bit peeved because I'm like, that was a bit rude for you to be. It was incredibly condescending when she turned around and was like, oh, you just want to go check your vitamin A levels. I'm like, no, like I prefer a natural practitioner. I would prefer to see a naturopath or a holistic doctor or somebody else than a GP, because I believe that natural doctors look at the body as a whole. And I think that the issue that I'm experiencing isn't necessarily just an isolated issue. I think that there is more to it. And it was just very, very incredibly condescending. And I was a bit annoyed. So I was like, well, anyway, it's fine. And she was like, your blood pressure is normal, so you're fine to go. I'm like, okay, well, could you maybe tell me why my blood pressure could be so low? And she was like, well, we'd have to wait for the blood test, which was like, fair enough. I understand you don't want to jump to conclusions. You want to do your blood work first. So I'm like, okay, cool. Go get my blood drawn, send it off for testing. And I wait 3 days, which for those of you, if you've ever done blood work, an iron panel can be done the same day. You can get your results on the same day. Thyroid panel, if I'm not mistaken, don't quote me on this, can take a little bit longer. Nonetheless, I waited 3 days. I hadn't heard from them. I called the office up. I said, do you have my blood results? Oh, yes, we do have your blood results. We will have the doctor call you with the results. I'm like, okay. So she says, no, the doctor will call you through results. I was like, okay, not a problem. I don't hear back from the doctor for another 2 days. I walk into that office. I said to the lady at reception, I said, please print off my blood results. I would like my blood results, please. Excuse me. She goes, oh, yes. The doctor will give you your results. I'm like, no, that's my blood. I want my results. You print it off and you send it through to me. I've been waiting for the doctor to call me for 2 days. After the 5 days after taking the blood work, I would like my results. Thank you very much. So she kind of reluctantly printed it off and gave it to me because she knew she could not keep my blood results from me. And I waited another 2 days before I got a call from the pathologist, not even the doctor. The pathologist called me, which obviously nothing wrong between a pathologist and a doctor. Both of them could give me my results. But I was a bit disappointed that the doctor didn't contact me with her answers to my questions. The pathologist called me, quite a interesting gentleman, to say the least. And at that point, I'd already gone through my blood work. I'd already pinpointed a few things that I had questions about. And I'd already at that point figured out where I was standing health-wise. Okay. For those of you who get their blood work, it can be incredibly overwhelming, first off. And the pathologist at that point then handed over, or well, just discussed my results with me. So first thing he said was that I was showing low iron levels. Okay, I would have to go back and double check which ones. I believe it was at that point low ferritin. And he was like, your iron is low. I was like, okay, thank you so much. He said, please go ahead and purchase yourself some iron supplements. I was like, okay, sir, but I'm already on an iron supplement. I'm taking X amount. So I was taking the max. It's about 54 milligrams that you can have per day for a female. 54 milligrams. Yes, 54 milligrams, somewhere in that vicinity. And I'd already I think I was taking 60 at that point. So I was taking a slightly extra. And I said to him, I'm taking this iron supplement at this dosage. He was like, okay, fantastic. Continue taking it. Okay. At this point, knowing what I know now, I looked back at my results again, and they were supposed to send me for an iron infusion at that point. My ferritin was so low. Bearing in mind, fast forward a little bit, I actually fell pregnant with low iron. She fell pregnant with that low iron. And then I ended up getting an infusion just before delivery when my iron levels had what they were. There was nothing. I did not have iron left, which is no surprise when you have a little one, right? So pathologist's advisement was to continue on with my supplement, which I believe, my personal opinion, was not the correct thing. If you are taking an iron supplement and you are not reacting well to an oral supplement, i.e. you're taking an iron supplement and your iron levels are still low, we need to do further investigation. So there should have been more blood work taken to kind of figure out exactly why the iron was low. And then to see from there on out, do we do a more aggressive supplement or do we do an infusion, or any other option that the doctor, would have presented at that point. So wasn't happy with that. Then that was all the pathologist discussed with me. I then obviously went in and asked further questions. I wanted to find out exactly why there were certain white blood cells that were low. I was being one of those really incredibly annoying people. I was like, why is this low and what is it for, right? And all I remember was being so incredibly disappointed because I had written down exactly what certain things were for, and my pathologist was mixing it up. He wasn't giving the right explanation for the right white blood cell. Not that that is incredibly important. Like, it didn't affect my like what was going on in my body, right? Because as we know, with white blood cells, it gives you an indication of kind of what your body is fighting off an infection. So there's more deeper detail into that, which I'm not going to go into now. But he was just mixing it all up. He wasn't explaining the right one for the right thing. And I was getting incredibly frustrated because I'm like, well, if you're getting this wrong and I have figured it out, that's not cool. Okay. I expect you to be able to know more than me, who just opened a book and did a 10-minute Google. I expect you to know more than me. Which, I mean, yeah, shame. I can be that annoying person. And I had then gave the pathologist an opportunity. I said, sir, is there anything else that I should be concerned of? He was like, no, everything else looks fine. I'm like, okay, cool. Thank you so much. And at that point, I ended the conversation because I was not prepared to entertain it any further. I had looked at my blood work and I had discovered that I was I had subclinical hypothyroidism. Okay, so when something is subclinical, it means that your blood work isn't going to necessarily flag it as you've got an illness or a disease. It's you're on your way. You are close to the end of the parameters. So for thyroid, you're going to have a perimeter for diagnosis on your blood work. Okay. Now, there is specifically for thyroid, there is a perimeter where if you're within that perimeter, it's normal. If you're just outside of that perimeter, there would be a second perimeter that's a little bit wider. That would be a subclinical, either hyper or hypothyroidism. And then if you're out of that perimeter, that is when your blood work would be flagged for either hyper or hypothyroidism. Okay. So I was teetering on the edge. My TSH in comparison to my T3 and T4, I was on the edge of having hypothyroidism. So it was classified as subclinical. So I like to call it you're on your way to being sick. Okay. And nothing was mentioned. Absolutely nothing. I do remember now, the pathologist did recommend that I get my thyroid tested in a year's time. In a year's time, guys. It was teetering on the edge of a diagnosis. And don't worry, come back, get it tested in a year's time. Now, whether that was the appropriate advice for Western medicine, whether that was appropriate, if that's normal, I mean, I guess fine. I don't think it's fine. I don't think that it's okay to tell somebody to come back and have it retested. You're giving them a year when they are so close to being flagged. And even if you don't say subclinical hypothyroidism, the fact is, like, the least the pathologist could have said was, I see your blood results. I see that your thyroid isn't 100%, isn't looking that great. Could you go see a dietitian, go see a nutritionist? You might be able just to help your thyroid through food or a supplement or whatever the case may be. Like, a doctor could not help me at that point, could not give me medication at that point because I was not ill. I did not have a sickness. But the fact that I was on my way, there was no advice, no direction, nothing. Okay. Now, quickly, because I think I didn't finish discussing this, was the concept of blood work. Okay. So I've always advocated for women to become advocates of their own body. Ask for your blood work, look at your blood work, research your blood work. It is incredibly overwhelming, but the internet has a bunch of information. And if you can piece two and two together and put a little bit of thought to it, you can figure out what questions to ask your doctor. Okay. Not to diagnose yourself, because you're not there to diagnose yourself. You're there to advocate for your own body, understand your blood work, and ask your doctor the right questions. Go to your doctor and say, listen, I see here that my TSH in comparison to my T3 and T4 isn't like an optimal level. Is that something to be concerned about? Is that something we can look into? For example, advocate for your own body. That is something I have been adamant to push on, because I don't see it happen enough. We go to the doctor's like, oh, you're fine. And then we go home and we're like, but I listed off 7 symptoms, so you just got dismissed. It's basically. And then we're like, oh, okay, well, I guess it's normal to have headaches and heart palpitations and have low blood pressure, which actually the pathologist said to me, he goes, I asked him about the low blood pressure and he goes, oh, it's normal for women to have low blood pressure. So no, not that low. Okay, so it's so choppy this morning. I've been saying a lot this morning and pausing and recording, and it's been one of those chaotic mornings on the road. So a big thing that I've always pushed is, obviously advocacy for your own body. And not that we have to be experts in reading blood work. I do think that you can, in some way, figure out where your blood work is sitting to be able to ask your doctor the right questions. It's not about replacing your doctor. It's not about shaming doctors or anything like that, or saying doctors are not great or whatever the case may be. It's honest. It's honestly just coming down to advocating for your own body, understanding that doctors are incredibly overwhelmed and can miss things. It's also like I feel that general practitioners are general practitioners, and they dealing with patients that some patients that are complaining just about a sore throat and just have a cold, and patients who have more serious things, and with such limited time we're dealing with surface level, entry level sickness, and that can be considerably overwhelming. And also, like, if you had to have a look and see all the symptoms that is related to that overlap, right? A headache can be a symptom of so many different things. Now, you go into a doctor and you say, "Doctor, I keep getting headaches and I'm feeling quite tired all the time." Like, that isn't good enough. Like, how is your doctor supposed to help you if you're giving such limited information? Of course, like, these doctors are kind of just like sending you for all the kind of blood work and not giving you proper answers and dismissing um, our symptoms. Don't get me wrong, I don't think all doctors are this good, right? I do think that there are dismissive doctors out there, and there are doctors that aren't listening and aren't willing to help. But I do think it's also an incredibly overwhelming job to have when your patients are coming to you with very limited information, and you're having to try and figure out what is wrong with my patient. How do I help my patient if at this point there could be 27 different things that could be wrong with my patient, right? So advocate for your own body, understand, go read your blood work, try and understand on a surface level what is happening with your blood work so you can ask your doctor the right questions. When you go to your doctor, you want to be so intricate with all your details, okay? I've got a lovely, not a GP though, I've got a naturopath that I see every now and again for sick kind of things. And I've taken my son to her numerous times, and I go in and I'm like, "I'm so sorry, but I'm going to give you a play-by-play," and I give her every single symptom, the time it happens, how it happens, what kind. Like, it's not just a fever, okay? I'm not like, "My son has a fever." I'm like, "My son has a fever. He's really hot on the forehead and on the back, and it rises up to 38.5 degrees, and then it drops again, and then it rises up." I'm like, you have to be so specific to be able to give information for your doctor to work with. Okay, advocate for yourself. Give as much information. Your doctor, you'll notice if your doctor's a good doctor because they'll thrive on that. They will get excited. Doctors don't. Not everyone just becomes doctors. Some people do just become doctors, but some people become doctors because they have a passion for it. Big surprise, okay? We do get people out there who do things because they're passionate about it. And going into this, like, the only reason why I had a bad experience wasn't because the doctor was a bad doctor or the pathologist didn't know what they were talking about. Could they be better? Yes, 100%. You could always do better at your job. Okay. Did I have a great experience? No, I didn't have a great experience. However, I did just walk in. I did just walk into that scenario. Okay. I did not go in well equipped enough with enough information. It was very surface level information. I could have done better. I could have gone, you know what, let me not go to the doctor, let me go to the hospital, let me go to a specialist, or let me run down additional symptoms, let me ask better questions. Okay, there was a lot more that I could have done to have a better experience with this GP or another GP and come out with better answers. Okay, I can see that in hindsight. I can see that now. And it's something that I've wanted to push so much with other women out there. Yes, you do get dismissive doctors out there. Yes, you do get doctors who are just kind of having patients come in and out and are kind of in that slum of seeing patients for 15 minutes because all they're seeing is patients that are complaining about a sore throat and a headache. And sending them home because you probably just have a cold that you could fix at home. You don't need medication to fix a cold, right? I get that. So advocate for yourself, understand your body, understand your symptoms, get to know what you're feeling, how you're feeling, so that you can ask better questions and advocate for yourself. Okay. I ended up sitting with subclinical hypothyroidism, low iron, which I continued to take. I took the advice of the pathologist and I continued to take, which is interesting because I took the advice of the pathologist and I continued to take the iron supplements and I remained anemic and fell pregnant anemic. And my gynecologist never took an iron panel when I fell pregnant. They only took an iron panel at 38 weeks to discover that I was severely anemic. I had my ferritin levels were 12. If anybody knows what that means in the realm of blood, you know that that is cock low. It's very low. And I was sent for a iron infusion. Yes, I felt so much better after that iron infusion, guys. Honestly, not to say that iron infusion is the answer for iron deficiency. There are other alternatives, and there are, good and bad things about iron infusions. Um, but I went for that. And then, so I followed the advice of my pathologist and ended up in that situation. And I know that my son probably is going to struggle with low iron because of that, because I had low iron during a pregnancy. So that sets up your child for their future is your iron levels will set them up for their future for their iron levels. And I then obviously didn't get any advice regarding my thyroid just to come back and test it for another year in another year's time. I did not take up that advice. I continued to put myself on a thyroid protocol for the follow up of 3 months, and then I retook my thyroid levels, and they were back to normal. They were actually perfect. They were actually pretty freaking perfect, if I may say so myself. And that was 3 months on a very strict thyroid protocol, which it wasn't like horrific. It was just, healthy whole foods and specific whole foods to assist the thyroid. And I took my advice, my own advice, or my own intuition, from what I understood from my studies, my nutritional studies. And I go, okay, if this and this and this is happening, let me tackle it with this and this. I wasn't sick. I wasn't ill. I didn't have a thyroid a full-blown thyroid issue. I was on my way to having a thyroid issue. And I was like, okay, cool. I could still fix this with food because that is what food can do. Food can keep keep you from getting incredibly ill, maintain symptoms, live a better lifestyle. It can do that. Can it cure? Debatable. That one's a bit more tough. That's a little bit more tough. Okay. I mean, you're not going to eat carrots and suddenly be cured. It doesn't quite work like that. Okay. It takes time, and some of us don't have time. Some of us don't have time to take that journey. Some of us need the medication now. So interesting that that was the case. But anyway, so that was sort of my story on in the beginning of me studying holistic nutrition, and a little bit of it was a small health scare. It wasn't that crazy. Um, but it was still enough for me for a light to go on and go, something's not right in the system, something's not right with me, and that needs to change. So I've, sort of fixed myself in some sense, and taught myself, learned. Luckily, I was very fascinated and interested in nutrition. I was a natural progression to my career. I am in a fitness and health space. So it was a natural progression for me. I know I'm not going to be able to teach for the rest of my life. And I don't want to be teaching 30, 40 classes a week. It's incredibly taxing on the body. It's exhausting. And I wanted to kind of still work, but in something a little bit more relaxed, and still be able to teach for as long as I possibly can, but have something else in the background. And nutrition was something I was vastly interested in, and kind of, trickled onto that, and realizing that there needs there needs to be a better system. There needs to be a better system, and us as mere people, mere civilians, us as women need to advocate for our own bodies, and we need to understand our own bodies. We need to pay attention to what our bodies are saying, because it does not help us going to see a doctor and going, oh, my blood pressure is low and I'm concerned. The doctor's going to go like, well, what am I supposed to do with that information? Is actually probably what a doctor is sitting there and thinking. What am I supposed to do with this information? Because I know that for me, when I see a client and I go, okay, so why are you here today? What brings you to me today? What are your goals? What are you trying to figure out? Oh, I've been struggling with X, Y, and Z. And I'm like, and so is everyone else. Okay, I can't do much with that information. Hence why, as holistic nutritionists, we are trained to take a full history from birth to now. I want to know your daily routine. I want to know what you do. I want to know what you eat. I want to know how you feel. I want every single little piece of information, because it helps paint a bigger picture. So I do feel sorry for doctors sometimes when we go in there and we're like, oh, I'm got a headache. Like, what are we supposed to do with that? Advocate for yourself. If you want to heal, you don't feel right, you know yourself. If you don't feel right, something's not right. Clearly, something is off. It could be as small as a nutrient deficiency to a full-blown thyroid issue. Like, it's worth just jotting the symptoms down. It is worth doing a bit of research and asking the right questions. Okay. Doctors have studied this. That is what they specialize in, is what they're professional at. They should be able to give you the answers. If they cannot answer your questions, find a new doctor. If they dismiss your symptoms, find a new doctor. As simple as that. Okay, but they've studied this, they know this. And if they're a geek and they really enjoy being a doctor, they're probably reading research papers and medical journals at night for bedtime stories. Okay, I'm not a doctor and I do that, but I'm weird. Okay. And they should be able to answer your questions. They should be able to. There are plenty of doctors out there that can. Plenty. There's some phenomenal doctors out there. You just have to find them sometimes. Okay. Anyway, that's it. I'm at the end of my journey. I'm heading off to work. Thank you for joining me on this ridiculous podcast. It's not a podcast. And I will catch up with you guys later in this week. Friday will be the next one. Okay, cool. Cheers. Bye.